Today we're going to talk a little bit about allergy testing. Testing for what you are specifically allergic to. We don't do a lot of testing for the total amount of allergic antibody that's in your system. It doesn't correlate really well with your allergy problems. For example, you can have a lot of allergies to several different things and actually have a total allergic antibody level which is normal. And you can have a very high allergic antibody level in diseases other than allergy, such as immune deficiency or parasite infections, some kinds of cancer. So it doesn't correlate. What we're specifically testing for are the things that you may be allergic to. And we decide what to test for on the basis of a really well taken, detailed history that includes a patient's symptoms, when they occur, where they occur, how severe they are, and then we decide what to test to. And it can vary greatly. Sometimes we're just testing to one thing. We're just worried about a peanut allergy and nothing else. Other times we're concerned about many different allergens being involved. There are two kinds of specific allergy tests. One is called usually a RAS test. It's a blood test. There are other names. RAS stands for radioallergosorbent testing. It's an acronym. And we don't do as much of that as we do skin tests. The reasons for that are multiple. One is you can test to a lot more and different things with skin testing than you can with the blood tests. The second is the skin tests are less expensive. A third reason is you get the results a lot faster. A fourth reason is that it's really a lot more sensitive than a blood test. For example, the amount of allergic antibody in your blood is measured in nanograms. And we measure the amount of gamma globulin, the antibody that fights infection, in grams. There's 1 million nanograms in a gram. So it's a tiny, tiny amount in the blood. So if it's not in the blood, where is it? Allergic antibody is mostly on the surfaces. There's 1 million times more allergic antibody on the surfaces than there is in the blood. And that's where you see allergic disease. You see allergic rhinitis, or what's commonly called hay fever, on the surface of the nasal airways. You see asthma on the surface of the airway to the chest. Asthma is an airway disease, not a lung disease actually, but an airway disease, allergic reaction on the surface. Or you can see allergic reactions in the form of hives on the surface of the skin, or on the surface of the GI tract you can have allergy reactions going on because there's a lot of allergic antibody there. Now, with the skin, you don't see allergic reactions to things in the air because it's usually not penetrable to things in the air like pollen, mold, dust mite, animal dander, which is in the air. So we just have to barely nick the skin, and then what we're actually doing is creating a miniature allergic reaction. And that's extremely sensitive, generally very accurate, reproducible, and consistent. We always do positive and negative controls to be sure that the tests are valid. For example, if you were taking an antihistamine, the positive control wouldn't be positive and the test wouldn't be valid. Now, when you're testing with skin tests, like I said, you can do a lot more things, and in a way it's a lot more reproducible and consistent. For example, if you have larger than a 3-millimeter wheal to an allergy test, it's generally considered that's the amount of swelling on the skin. It's generally considered to be a significant positive. It varies a little bit from allergen to allergen, but generally that's pretty much true from one food or inhalant allergen to another. With a blood test, the significance of a positive test varies tremendously. A level of 2 to an egg blood test, 90% of those patients would have a reaction if they ate eggs. But a level of 70 to a wheat blood test, 90% of those patients would not react to wheat if they ate it. You don't have that kind of huge variability generally in skin testing. So in a way, it's a lot more reliable, and it's a lot more sensitive. You will miss a significant amount of peanut allergic patients with the blood test, and it's all very, very rare to miss it with a skin test.